Good day, fellow learners. I'm your mentor, Gapuz, your fact check buddy. Don't forget to pronounce the check mark in between the words fact and buddy because it doesn't sound good without it. Okay, joining you once again for another teaching and learning session as we engage in our quick fix session. Just the secrets for this coming month. For those of you who are taking the NCLEX, this session is for all of you guys. And without further ado, let's begin. Okay. Now let's pay particular attention to your vitamin A deficiency. And before we talk about vitamin A deficiency, let's talk about the functions of vitamin A. Of course, everybody knows that it's needed for good eyesight. It's also needed for good skin, and it is also needed to enhance the immune system. So it has a role in fighting infection. Okay. Now, your vitamin A is also known as retinol. Now, question, what would be the common sources for vitamin A? Now, we begin with liver. Okay, that's very high in vitamin A. However, if your patient is pregnant, you do not just give liver pate because liver pate could increase the risk for toxoplasmosis. So it's very, very important that your patient should be given that information. Aside from liver, milk is also high in vitamin A, okay? And then, of course, your eggs is high in vitamin A and your fish liver oils. Now, question, what conditions would usually lead to a deficiency in vitamin A? Inadequate intake of vitamin A or too much intake of rice, especially for us Filipinos, you know, that's our staple food, and too much intake of alcohol or alcoholism when a patient is a fully vegan diet, okay, on a full vegan diet. And of course, for patients with the 3Cs. And what are these conditions? Celiac disease, cystic fibrosis, and Crohn's disease, because all of these three conditions could lead to malabsorption syndrome. Once again, celiac disease, cystic fibrosis, and Crohn's disease that leads to malabsorption of vitamin A. And of course, an infectious condition called Giardiasis or traveler's diarrhea. You know for a fact that your traveler's diarrhea leads to, okay, a deficiency in vitamin A. Now, how would we know that the patient has a deficiency in vitamin A? First and foremost, if you'll be asked, okay, came just across to my mind, which one is considered as the richest source of vitamin A? Actually, it's the liver. Okay, so one serving of liver is considered as a good source for 1 week supply or 1 week requirement for vitamin A, which simply means that too much intake of liver or liver pate is also not good because it could actually increase your vitamin A. Okay, now, what is the recommended dietary allowance for vitamin A? It depends on the gender. For women, it's 600 micrograms. For men, it's 700 micrograms. Now, if the patient is pregnant and breastfeeding, then we give 1,300 micrograms of vitamin A from the sources which we mentioned a while back, and the highest amount should come from liver. Okay, now how would we know that there's vitamin A deficiency? Okay, definitely the eyes will be affected, so there's gonna be ulceration of the cornea, so it's called keratomalacia. Okay, and then dryness of the conjunctiva, which is also common in patients with Sjogren's syndrome. It's called xerophthalmia. Okay, then the presence of an irregular shaped foamy patches on the sclera of the eyes, the white of the eyes. Okay, it could be oval or triangular, and this is called Bitot spots. And definitely the skin will become dry and there's gonna be pruritus. Okay, so you have to remember that sometimes the deficiency could result from over intake of fruits. Okay, now remember, some people are saying if you have like colorful fruits, they're usually high in vitamin A. Not necessarily, because your orange and lemons are very, very colorful. They are really yellowish, sometimes bordering to yellowish orange, but they don't contain much carotene or vitamin A. So therefore, your orange, your lemon, and grapefruit may not necessarily contain high amounts of carotene or vitamin A. Okay, so which simply means these are not considered as good sources of vitamin A. Let's move on. So, okay, Here is a functional concept. In a client with vitamin A deficiency, night blindness develops. Okay, so using that functional concept, let's try answering a sample question. Which of the following foods are good sources of vitamin A? Okay, we've talked about this a while back. So fish, yes. Cheese, yes. Eggs, yes. Rice, no. Okay, that could actually lead to a deficiency. And milk, yes. Let's try answering a sample question. So which of the following is the richest source of vitamin A? We talked about this earlier on class. I told you that not all brightly colored fruits are high in vitamin A. So the answer to this question, we've talked about it, liver. Remember, one serving could be equivalent to your recommended dietary allowance for a week, so not too much on your liver. The answer is 2. Next question. Which of the following factors can potentially lead to vitamin A deficiency? Full vegan diet, yes. Remember that the difference between a vegetarian and a pescatarian person is that the pescatarian person eats seafoods and fish, okay? So the full vegetarian person, they don't eat seafoods and fish. They just eat vegetables. Now, if they eat eggs, they're called ovo-vegetarian. If they drink milk, they're called lacto-ovo-vegetarian, okay? So celiac disease, yes. Cystic fibrosis, yes. These 3 actually leads to malabsorption syndrome that could potentially cause vitamin A deficiency. And fracture, no. That's usually related to calcium deficiency. Good eyesight is not related to vitamin A deficiency. It's actually indicative that you have adequate vitamin A. Okay, put an X. Next. Which of the following are food sources for vitamin A? We have milk, yes. Liver has the highest vitamin A. Eggs, yes. Rice, no. And grapefruits also, no. Okay, remember the drugs that should never be given with grapefruits. You have cyclosporine or sandivion, you have verapamil and diltiazem. Don't forget, okay. Today's good news, we'd like to say congratulations to Buenafe Alikna, USRN of the University of Cordilleras, who joined our test preparations program for the NCLEX RN and passed the test for the Alaska Board of Nursing last September 2021. Congratulations, Benefe, and may you be able to turn your great American dreams to reality. Thank you for trusting the Ray A. Gapuz system. And here is her message. Thank you, Lord. I passed my NCLEX RN. It's been 2 years when I started to process my application. Dahil pandemic, inabot ng napakatagal. Thank you, RA Gapuz, from local RN to NCLEX RN. Hindi nyo ako pinabayaan. It's difficult to concentrate sa review knowing ang hirap makakuha ng slot for NCLEX exam due to pandemic. Pero hindi ninyo ako pinabayaan, RA Gapuz. That's the RA Gapuz way. It really helps sa akin yung review, YouTube channel, and books ninyo. So patuloy po sana kayong tumulong sa mga taong nangangarap maging USRN tulad ko po. Thank you, Lord. Thank you, RA Gapuz, Gapuz Baby. From local RN to USRN, I think that's her program. That's Faye Buen Alikna, USRN. Once again, Faye, congratulations for making it on the NCLEX RN. I hope more and more of your classmates would follow through. Congratulations. And for those of you who have yet to subscribe to our YouTube channel, please do so. It's entitled Gapuz Mentors. You can choose which one of almost 200 videos that we have available would you want to watch. But if I were you, you should be asking me some guides on what do you need to study for your test. I will be giving it to you for free. And that's a promise. So join us in this mission. Our goal is to provide free NCLEX RN application and review to 100 nurses. And to help us achieve this, please just watch and finish the ads in our videos. Thank you, thank you, thank you so much. Okay? And here's our disclaimer.